Everyone has eyesight changes as they grow older, but few people know that macular degeneration, a once untreatable eye disease, is the leading cause of blindness for those aged 55 and older. It affects more than 10 million Americans each year. Here's how Dr. Vivian Kim helped a local man with a drug called Lucentis, which gave her patient a new sight to see.
It feels familiar.
World War II veteran and retired Navy pilot Wes Nelson noticed his eyesight starting to waver a few years ago.
If I were to look at a telephone pole, it might have a kind of an S-turn in it, or it might appear segmented, like one segment not quite touching the other. You know, flying for 58 years, you'd think you'd get tired of it, but you never do. I didn't think anything of it at first, and it only affected my right eye. And then as time went on, I immediately went to my ophthalmologist.
Wes's optometrist sent him to Dr. Vivian Kim at IQ Vision Care, who diagnosed him with macular degeneration.
Macular degeneration is a disease of the retina in the macular region that affects central vision. It is a degenerative change that happens predominantly, but major risk factor is age. Initially, in the early stages of macular degeneration, the patient probably would notice some blurriness of vision, and just colors don't seem as bright. Things are a little bit foggy, and as the disease advances and becomes more advanced, then you start to lose central vision, like not being able to make out faces, not being able to read, losing driving vision, level of vision.
Dr. Kim says there are two types of macular degeneration, wet and dry.
The dry kind is actually more prevalent. 80 to 85% of the population has the dry kind. Everybody starts off dry, and then the 15 to 20% progress to the wet kind. And there's a lot of attention on the wet kind of macular degeneration because it is actually more devastating central vision loss, and it happens more quickly and rapidly.
While there is still no cure for this devastating disease, there is a new drug called Lucentis that has patients lighting up with hope.
This drug was for the first time offered patients the hope of improvement of vision and preservation of vision. 95% of patients actually get improvement of vision. 30 to 40% of patients actually gained more than 3 lines of vision from when they started out with their treatment.
Night and day. I mean, you're going from not being able to see to where you are able to not only to see but to drive a car safely.
Mr. Nelson, how are you doing today?
I started with a black oval in front of my center of vision, and as time went on, that oval became translucent, and what was a black spot now appears only as a gray translucent area.
So Dr. Kim is going to be doing a Lucentis injection today on the inside of your eye, and that's
because of the Lucentis, Wes has regained some of his vision. He says he doesn't know what he'd do without it.
First of all, I wouldn't be able to read at all. Secondly, I wouldn't be able to drive at all. And thirdly, I would not be able to live a normal life.
Here's how the procedure works. When performing an intravitreal injection procedure, antibiotic, anesthetic, and antiseptic solutions are administered to numb the eye and prevent infections. Next, a small syringe is used to inject into the intravitreous cavern. This process is essentially painless, and stitches are not required.
The thought of getting an injection in your eye is painful. The injection itself is not painful.
The procedure was painless, and Wes says he was pleased with the whole experience.
I'm also lucky that I was referred to Dr. Kim, because Dr. Kim not only is a retinologist, but she has marvelous hands, and she gives you a tremendous feeling of confidence when she's treating you.
1 drop 4 times a day.
This drug actually is like a miracle drug in the sense that patients are able to maintain independence because we are able to preserve useful vision, reading vision, driving vision to that extent with the new drug. Now with this treatment, I have patients who are legally blind when they come in to see me who are back to 20/30, 20/40, which is reading vision and driving vision.
The forefront of a medical miracle. So I'm very impressed.
And Wes can't help expressing his thanks for his restored sight and Dr. Kim's treatment.
I think I'm extremely lucky.
It looks like Wes and others with macular degeneration have new hope in sight. For more information about macular degeneration, log on to medwatch.communitymedical.org.